Let's start with the views of the Minister of Health, Professor Onyebuchi Chukwu, on the performance of the health sector in 2013.
Certainly it's gone well. On many fronts, I think we've made progress. But of course, a mixed bag. There are also things that made us to be anxious. But on the fair side, if you look at public health, we made tremendous progress. For instance, Nigeria this year was formally certificated by the World Health Organization as a guinea worm-free country. So we've eradicated guinea worm. And this is just the climax of 4.5 years of having not recorded a single case. So we have our certificate now. So that was something that is very important for a country to have eradicated a disease that is not what we call vaccine preventable. So most of the diseases that often tend to be easily eradicated are those that are vaccine preventable. But the world set out years ago to eradicate guinea worm, and Nigeria is part of the elite group now. Then you look at even the polio that is giving us cause for concern. We've made tremendous progress. If you look at polio, yes, we had cases last year and we had cases this year, but 50% reduction is no mean achievement. It's not where we want to be 100% reduction. But if we have reduced it by 50%, it means we're on the road to eradicating polio in Nigeria. And what's even more important to me is that immunization coverage has never been this good in the last 2 decades. The last time we had immunization coverage well above 80% was around 1990, 91, 92. After that, we started crashing in this country. But today, we have more than 80% immunization coverage. We are happy that UCH Ibadan resumed open heart surgery after more than a decade. These were achievements recorded this year alone. Of course, new hospitals joined in carrying out kidney transplant. Lagos University Hospital was one. University of Ilorin Teaching Hospital was another. And the other hospitals are coming. What is retarding the growth of kidney transplant in this country has to do with funding. What were the downturns this year? Of course, we remember clearly what happened with measles. We had outbreak of measles nationwide. That was very unfortunate. We're going to work hard next year. We shouldn't have that to be in place. We also remember the cholera outbreak too, which is still smoldering in some states like Kano. That was also unfortunate.
On the doctor's strike, here's what the minister has to say.
Well, you recall the Nigerian Medical Association declared an industrial dispute. They held meetings with the government. They proceeded on what they called a warning strike that lasted more than 5 days. And we did sign a memorandum of understanding. And we had hoped that with the memorandum of understanding, at least they should have halted the warning strike, which was in its first day at the time we were signing. They didn't do that. The warning strike ran out its course. But some of the 3 things they felt were minimum demands. If they were not to proceed on strike on the 6th of January, the government is currently working on them. There are things that involve financial implication. And you know, anything that involves money, apart from the fact that it's not only the executive that is involved, it could also involve National Assembly as the people who actually by the Constitution appropriates funds. It's not something you can just treat completely in one day. And it's not, you don't just issue circulars until you are sure the country will be able to accommodate it within that time frame. But all I know is that presently, government is working on it.
For the president of the Nigerian Medical Association, Dr. Osahon Enabulele, Nigeria did not make the kind of improvements expected last year in the health sector.
In the area of health human resource, that again is an area that still needs to be looked at. It didn't receive much attention fundamentally in terms of human capital, health human resource development, in terms of exposure to training, capacity building, as expected of the various institutions and governments. Essentially, the welfare of the health workers still needs to be attended to be able to, of course, arrest the very immense proportion of emigration, the emigration of the health workers to other countries. So that area of capacity building and development of the health human resource still needs to be given some focused attention. Yes, I agree that there were some attempts made by some state governments and indeed the federal government. Federal government essentially with the return of the overseas, compulsory overseas training for resident doctors. But on a global scale, much more perhaps could have been done in 2013 to up the stakes in terms of exposure to cutting-edge technologies, exposure to some, higher level skills, and capacity for health workers to be able to deliver, highly skilled, services and quality services to Nigerians. One would also want to look at the fact that in 2013, we also were not able to address fundamentally the whole issue of quackery. It still looks as if the state, as it were, and its agencies could not deal so much on the issue of quackery, which of course which was seen in several dimensions, particularly the baby factories, which were sprouting up in several parts of Nigeria, and of course which cost Nigeria a high level of international embarrassment. We hope, therefore, that in 2014, that the health regulatory councils, particularly the Medical and Dental Council, will be able to rise up to its responsibility, to their responsibility of putting in check these charlatans with the acts of charlatanism, and of course reduce the international embarrassment, reduce the level of complications and untold harm done to innocent Nigerians on account of their very unethical and illegal practices.
So, what should Nigerians expect in 2014 with regards to healthcare delivery in the country?
On the public health sector, we expect further improvement. In fact, we are targeting that next year would interrupt polio transmission, wild polio transmission in this country. So that is one area. Two, we are going to further improve on the coverage of routine immunization. We want to be in the 90s in terms of percentage coverage. Three, we expect, in terms of what Mr. President said, in terms of encouraging the government to collaborate with the private sector to establish more high-end, world-class diagnostic and treatment centers in this country. Four, we are going to expect a lot of progress in malaria. Now that we are talking about malaria elimination, we hope the National Economic Council will eventually approve of the plan that the whole country has been discussing about strategies to really eliminate malaria in this country. So we are looking forward to that. We're also looking forward to the issue of general governance. Remember that Mr. President has currently a committee that is working now, trying to carry out Mr. President's mandate to bring out recommendations to Mr. President on how we can really have true and lasting harmonious working relationships amongst all the health professionals in the public health sector. We believe when that report comes out that it will help the country to address this issue once and for all. We pray. So, generally speaking, I think we can expect more progress in the health sector.
First is to get Nigerians to understand and appreciate that they have a very fundamental role to play in driving progress in the healthcare system. And that role has to do with Nigerians understanding that the politicians, the political leaders, their leaders are not being gracious by giving them, extending to them healthcare services. That it is their fundamental rights to have access, both physical and financial access, to healthcare services. It remains a fundamental social obligation of government So that is one. Two is to be able to drive some more synergy, and collaboration and support for the institution of a National Health Act in Nigeria to, of course, help to superintend the regulation, as it were, of the healthcare environment. Unlike now, where it looks like the healthcare landscape is where all players are welcome and no player is under any kind of uniform regulation. Everybody doing his own thing, and that leading in chaos, and the kind of anarchy, near anarchy that you will be seeing in the healthcare environment. That shouldn't be. Ideally, there should be, yes, people operating at their own levels in terms of professional levels, but there should be some uniform, regulation, so that everybody knows that, look, when you are deviating from the norm or you are moving out of your boundary, there is that uniform body that can call you to order and say, look, this is not where you're supposed to belong. This is not where you're supposed to practice. So the National Health Act, aside from some other salutary provisions which are there, particularly the area of the huge investments to be provided for the health of Nigerians in terms of the percentage of the consolidated fund of the federation that's supposed to accrue to the people in terms of using such funds for the provision of primary care services and even secondary care services. The National Health Bill will fundamentally also help to reduce or restrict these very unnecessary frequent travels, by political office holders, as prescribed in one of the provisions of the National Health Bill. I think particularly Section 45, Clause 45 or 47 of the National Health Bill. So the institution of a National Health Act in 2014 perhaps will signal the beginning of our serious commitments towards the development of the healthcare environment. I also expect that in 2014 there will be greater harmony amongst the healthcare professionals, now realizing that there are international best practices, there are global standards, and with continuous engagement, I expect that in 2015 there should be greater harmony, better harmony amongst the health workers in our country, to be able to see the patient as the overall owner, or rather as the overall beneficiary of healthcare services in our country.
We still have some time to see what's happening in the news. We start off the news segment with a report from Kano State, northwest Nigeria, where at least 7 people have been confirmed dead following an outbreak of cholera in Badawa Galadima ward in Nasarawa local government. The head of the local government health department, Mr. Muazu Doka, who confirmed this, also said 68 infected people are currently receiving treatment at various health centers. Out of the victims, 29 are at the infectious disease hospital, while the remaining 39 are in other hospitals within the state. 2 appointments in the health sector. The Director General of the National Agency for Food and Drug Administration and Control, NAFDAC, Dr. Paul Ohi, has been reappointed for a second term of 5 years to run the agency. According to a press statement from the Federal Ministry of Health, the reappointment is with effect from January 14, 2014. A Chinese obstetrician is on trial for stealing newborn babies and selling them to child traffickers. Zhang Shuzia, who worked in Chinese Fubin Maternal and Child Healthcare Hospital, was accused of selling 7 babies between November 2011 and July 2013, including a pair of twins. Under China's strict population control policies, most couples can only have 1 child, and there's a strong preference for healthy baby boys. Finally, an international team of researchers has found more than 40 new areas in DNA that increase the risk of rheumatoid arthritis. The work is the largest genetic study ever carried out, involving nearly 30,000 patients. The A research team led by Professor Robert Plank of Harvard Medical School compared the DNA of arthritis patients with those without the disease and found 40 areas that were linked with the disease. The hope is that drugs can be developed to compensate for these faults. The investigators believe new drugs could be developed to target areas that could one day provide a cure for the disease. The findings are published in the journal Nature. That's health news this week. Let's have your assessment of the health sector and the new things you'd like to see on the program this year. The way to go? healthnews@channelstv.com. You can also send a text to 081-864-38129. And we can continue the conversation on Twitter at Yomi_Otaigbe. Thank you for your time. I'm Yomi Otaigbe.